TTC Part 3
So
Women with
today we're
Blocked
doing the
Fallopian
part 3
Tubes.
of TTC. Very interesting journey to us for us. On the part 3, we'll be talking about women who have a blocked fallopian tube. Come close. If you're a woman and you are attempting to get pregnant and you do not know the state of your fallopian tube, that's an act of deception. You have been trying to get pregnant for the past 2 years and you have never for once checked your fallopian tube. You're actually playing a prank on yourself. So how do you check your fallopian tube? So there's a procedure called an HSG, hysterosalpingogram, more like doing an X-ray of the fallopian tube. God in His infinite mercy made us to have, women rather, to have two tubes, the left fallopian tube and the right fallopian tube. So most of the time, a woman may have a blocked fallopian tube on the right, on the left. But there are women who have a blocked fallopian tube both on the right and on the left. The question is, what do I do if I have a blocked fallopian tube? How do I identify that my fallopian tube could be blocked or I have a high risk? So what are the things that could cause a blocked fallopian tube? Number one, poorly treated infection called PID, pelvic inflammatory disease. People who have these symptoms, if you are in this category of people that are having these symptoms, please, you have to look closely. Abnormal vaginal discharge, you're having frequent pains in your lower abdomen, your pelvic pains frequently, then abnormal vaginal discharge. You're always treating infection from time to time, poorly treated infection, possibly gonorrhea, chlamydia, and what have you. You had an ectopic pregnancy in the past, and you lost one of your tubes. You have to validate the other one is intact. With one tube, a woman can have 10, 15, even 5 kids, as it were. Now, there's some. So, it's also very imperative to state that fibroid can pose a risk for a blocked tube. Another thing you have to understand is that some women who have a blocked tube or potentially have a blocked tube, some of them may have pains during sexual intercourse, may have a pelvic pain, as I said earlier, abnormal vaginal discharge. Now, if you have a blocked tube, what do? There are procedures that could help salvage the tubes and put you in a better position to do an IVF. But not everybody can afford an IVF, so what's the way out? Watch out for parts 4 of TTC.